Hello and welcome to Dr. Joe, a medical program where we discuss various health issues affecting humanity at large. Today, we're going to be focusing on sexually transmitted infections. And before we go any further, please kindly click the subscribe button below and like and share this video. Sexually transmitted infections are, as the name suggests, sexually transmitted. They used to be called sexually transmitted venereal diseases, but we changed that nomenclature to sexually transmitted infections because there are certain individuals who might be having the infection without suffering from the disease. So those individuals also need to be put in the same bracket. So now we call them sexually transmitted infections. What exactly are sexually transmitted infections? These are infections that are purely transmitted through sexual intercourse or mainly transmitted through sexual intercourse. And there are mainly three types or subcategories of sexually transmitted infections. The first type are bacterial infections. The second type are viral infections. And the third ones are protozoa infections. So the examples of bacterial infections include syphilis, chlamydia, and gonorrhea. Then when it comes to viral infections, the common ones are one, HIV. It's also a sexually transmitted infection. We also have what is called HPV or human papilloma virus. Remember, we talked about HPV type 16 and 18 as the risk factors of CA cervix. So remember, HPV is also a sexually transmitted infection. We also have what is called HSV or herpes simplex virus. We've got type 1 and type 2. Type 1 mainly affects the mouth and type 2 mainly affects the genitalia. So those are the main types of viral STIs. We also have what are called protozoan STIs. An example of that is Trichomonas vaginalis. It's one example of a protozoa STI. So those are the main subtypes, but generally there are more than 30 types of STIs. The ones that I've just given you are the common ones or the ones that are commonly found. When it comes to prevalence, sexually transmitted infections affect more than 1.1 billion people worldwide. This is according to 2014 statistics. This means approximately 14% of people are affected by STIs in their lifetime. And that's a significant number. That means about 1 in 6 to 7 people has been affected by an STI in their lifetime. And also, believe you me, STIs also cause mortalities. Like they can actually kill people. From the studies that were done in 2014, about 108,000 people actually died from STIs or STI-related complications. So it's very important for someone to get screened and to get tested and to get treated for STIs. Now that we've looked at the definition of sexually transmitted infections and we've looked at the types of sexually transmitted infections and we've also looked at the epidemiology of sexually transmitted infections, let us take a short break. Welcome back to the second segment of Dr. Joe. Today we're focusing on sexually transmitted infections. We've looked at the definition of sexually transmitted infections, we've looked at the types of sexually transmitted infections, and we've also looked at the epidemiology of sexually transmitted infections. Now I want to take a look at the signs and symptoms of sexually transmitted infections. What exactly will you be suffering from when you've got a sexually transmitted infections? One, before we go any further, I want you to note that most sexually transmitted infections do not have any symptoms. We say they are asymptomatic, they are symptomless. So when you do not have any symptoms, it does not mean you're not suffering from, you are not infected with sexually transmitted infections. You might not be suffering from anything, like you don't have any symptom, but you will be infected with sexually transmitted infections. For example, if your partner is infected and has got symptoms, it definitely means you are also infected. You might not have any symptoms. I always have cases where patients come in, it's a husband and a wife, a boyfriend and a girlfriend, they come. The other one has got symptoms, say the wife has got a discharge or something like that. Then the husband says, just treat the wife, I'm not suffering from anything. Believe you me, once your wife or your partner has got an infection, it also means you also have an infection, whether you've got symptoms or not. Now that we've cleared the air on that one, let's get into the symptoms. One, the first symptom is a discharge. When you get a discharge, if you're a male, it means definitely you've got an STI. If you've got a discharge, it means most likely it's gonorrhea. Whatever color, however discharge you've got, how much discharge you've got, it doesn't really matter. Once you've got a discharge, it means you've got an STI. So for men, any kind of discharge from the urethra means you've got an STI. When it comes to ladies, discharges vary. Most ladies, in fact all women, have some form of discharge. So generally we say if you've got these three symptoms changing on your discharge, it means most likely you've got an STI. One, the discharge has increased in volume. We say it's now copious. If your discharge has increased in volume, most likely you've got an STI. Two, change in color. Your discharge has changed from white. Normally women have a whitish discharge. If it has changed from white to say cream, brown, or any other color, yellow, whatever it is, most likely it's an STI. The third thing, if the discharge is now foul smelling, if you can smell the discharge, it means most likely you've got an STI. So let's do a mini recap. One, if you're a man and you've got a discharge, whatever color it is, however the quantity is, you've got an STI, seek treatment. Two, if you're a woman and you've got a discharge and it has increased in volume, it has changed color, it's now got a smell, most likely you've got an STI, seek treatment. So the first symptom is a urethral discharge. The second symptom is genital ulcers. If you've got an ulcer, it means you probably have an STI. Ulcers are just wounds around the genitalia. It might be on the shaft of the penis, on the head of the penis, on the foreskin. It can also be on the vulva, on the vagina, around the perineum. If you've got ulcers of whatever nature, suspect you've got an STI. Ulcers are generally caused by HSV. It can give you some ulcers. Then also, if you've got a rash, any form of a rash or pimples that you see on the genitalia, please suspect you've got an STI and seek medical attention. So the three main symptoms are the discharge, urethral discharge. Two, if you've got ulcers, any wounds around your genitalia. Three, if you've got any rash on your genitalia, suspect you've got an STI. So always be on the lookout for these three symptoms. There are other symptoms that could come with STIs that are not so diagnostic of STIs. These include urinal symptoms. One, you could have what is called dysuria, pain when you're passing urine. If you feel some pain when passing urine, there's a possibility that it's an STI. Also, seek attention. If you're having what is called frequency, or you're going to the toilet more often, you go to the toilet 3, 4, 5 times at night, it might be a sexually transmitted infection. Always think of that. With these other symptoms that I just said, frequency and dysuria, if you've got those symptoms, they could point towards what is called a urinary tract infection, UTI, not necessarily an STI. It's a possibility that you might be having an STI or it could be a UTI. So always seek medical attention. Whatever it is, whether it's an STI or a UTI, seek medical assistance. Now, when it comes to the mode of transmission of sexually transmitted infection, one, it's sexually transmitted, like we said. That means if you have vaginal intercourse, you are most likely to suffer from STIs. You've got a possibility of suffering from STIs. They are spread through vaginal intercourse. They are also spread through anal intercourse. And the third route of spread is oral sex. So with oral sex, you can actually have blisters around your mouth that could signify an infection. Could have throat infections that could signify an STI. And then with genital infections, you have the symptoms that I just described. With anal STIs, you also have ulcers, and you might also have some discharge from the anus if you've got anal STIs. So these are the three main modes of transmission of these STIs. And then now let's look at the differential diagnosis. We talked about urinary tract infections. This is one of the major differential diagnoses. We get patients that got urinary tract infections and they think it's sexually transmitted infection. So when you've got, mainly if your symptoms are increased frequency of passing urine, and two, if one of your symptoms is dysuria, pain when passing urine, if those are the two main symptoms, without a discharge, without ulcers, usually it's most likely a urinary tract infection or UTI. Then with ladies now, there's another differential diagnosis that is very common. I get a lot of these, and patients always come and ask, especially pregnant women usually suffer from what is called thrush or vaginal candidiasis. This is caused by a fungus called Candida albicans. So when you get this candida albicans multiplying in your vagina, it causes symptoms that we call thrush or vaginal candidiasis. So this candida albicans is a normal vaginal flora. Yes, every woman has got candida albicans in their vagina. That means every woman has got it in their body, but it gives you symptoms when it multiplies beyond the normal range. Usually it increases when you're immunosuppressed for whatever reasons. The commonest cause being pregnancy, things like diabetes, cancer, HIV could also cause immunosuppression and cause you to have thrush. With thrush, the main symptoms that you have: one, the discharge has increased in volume. This is common for both thrush and STIs. Two, it's still white in color. Usually the thrush, the discharge does not change color from white to yellow like what happens with STIs. With thrush, the discharge remains white. Three, with thrush, you've got itchiness. You get a patient who comes and they tell you that it's so itchy down there, I can't even get into a combi. I'll be shy that I'll start scratching. If you are feeling that itchy, most likely it's a thrush. So the main symptoms of a thrush: one, the discharge has increased in volume. Two, the discharge is still white in color. Three, there's itchiness, vaginal itchiness. And we say thrush mainly affects women. With men, usually it can go on your foreskin, but once you wash it off, it disappears. The environment around the penis is not conducive for candida albicans to grow. So thrush generally doesn't affect men. It mainly affects women. For now, let's take a short break and come back in the third segment and discuss the diagnosis and the management of sexually transmitted infections. Welcome back to the third segment of Dr. Joe. Today we'll focus on STIs, sexually transmitted infections. We've spoken about the definition of sexually transmitted infections, the types of sexually transmitted infections, the epidemiology, the signs and the symptoms, and we also looked at differential diagnosis of sexually transmitted infections. Now in the third segment, we want to look at the treatment of sexually transmitted infections and the diagnosis of sexually transmitted infections. The diagnosis is mainly clinical. By clinical, we mean we make the diagnosis from the clinical features that we find. Yes, there are laboratory tests that can confirm sexually transmitted infections, but we've got a number of cases where you do laboratory tests and they're still negative, but the patient is symptomatic of sexually transmitted infections. We still put them on treatment. But if laboratory tests prove that you've got an STI, definitely you've got an STI. But if they come back negative, it does not 100% exclude the possibility of a sexually transmitted infection. So if you come to us with the symptoms that we discussed in the last segment, discharge, dysuria, you come with ulcers, with rashes, we say you've got an STI until proven otherwise. So we put you on treatment. If your partner has got no symptom, or you've got no symptom and your partner has got some symptoms, we still put you on treatment. So we put both of you on treatment. So the diagnosis mainly is the clinical features and the laboratory tests. Laboratory tests vary. You can do blood tests for things like syphilis. You can do what is called RPR or TPHA. It's a laboratory test that we do on syphilis. When it's positive, it means you've got syphilis. You can also do pass swabs for things like gonorrhea. We take the discharge that you're producing, we put it in the lab, then we culture it. If we pick any infections, we treat according to the results of the tests. Then after we do the test, now we put you on treatment. Treatment varies from the types of the STIs. If you've got viral STIs, we'll give you antiviral drugs. They are different from the antiretroviral drugs. For example, if you've got HSV, Herpes simplex virus, can give you what is called acyclovir for a week. If you've got bacterial infections, we give you antibiotics. At times we give you injections. There are times we'll give you 2 injections at first, then we'll give you a continuation of oral antibiotics that you have to drink orally, or we can put you on just oral antibiotics depending on the extent of the STI that you're suffering from. If you've got fungal STIs, we'll give you antifungals. If they are protozoa, we give you protozoa, anti-helminths like metronidazole. So when it comes to STI treatment, it differs from men and women. With men, usually we just give you injections. Usually we give you 2 injections, or there are times where we just give you 1 injection, and of course a course of oral antibiotics, just 1 course. for 7 days, then after that, you're cleared. If you're a woman, normally we give you antibiotics, injections, usually 2 injections, then 2 types of tablets to take. One is an antibiotic and the other one is an antiparasitic agent, metronidazole. So normally with women you get 2 types of oral antibiotics. With men you normally get 1 type of oral antibiotics. This is mainly for bacterial infections, e.g. gonorrhea, and then Trichomonas vaginalis is also covered by metronidazole. So normally that's what we do. And I want to emphasize again the point that if you are asymptomatic and your wife or your husband is symptomatic, we treat both of you. So there is no excuse that I'm not having any symptoms, my partner is the one who's having symptoms. We treat both of you. If we treat one partner and we don't treat you, you might be having the bacteria in your body, but it's not manifesting symptoms. When you go back and sleep with your wife, you transmit the infection again to them, and they'll come back with recurrent infections. So recurrent infections risk the patient to suffer from resistance. So when you get resistance, now it means when you give you the normal antibiotics that we normally give, you are not responding to them. We need to give you more expensive antibiotics. I had a patient that I was talking about that we had gonorrhea for 2 years. We had to do the blood test and to do the culture of the bacteria and prove the patient had gonorrhea. Then it was resistant to most of the ordinary antibiotics that we give. It was only sensitive to one antibiotic that is a very expensive one called meropenem. It was costing the patient almost $500 to treat the infection for a week, for just 1 week. So imagine you exposing yourself or your wife or your husband to such a risk of suffering from resistant organisms by not taking your medication when it has been prescribed. So take home points. 1, when you suspect you've got an STI, things like a urethral discharge, urethral discomfort, if you've got any genital ulcers, if you've got any genital rashes, please visit your doctor and get tested and get treatment. And you're going to put on treatment whether you do not have any symptoms and your wife or your husband is the one who's got the symptoms. Please cooperate with the doctors and take your medication for the full course and finish the course. Once you finish the course, most STIs will disappear after the 7 days. There is something that we call the incubation period, the time frame from the time where you contract the STI to the time when it manifests, when you see the symptoms. It varies with certain infections. Some will manifest in the next 2 days, some 7 days, some can even go for weeks or even months. There are some that will just present and they disappear. Just get a rash and it disappears on its own without taking any antibiotic or any form of treatment. Then when you get that, usually you think you are now treated, you are now healed, you are now well. Then you go home and you live your life, but it will be in your system and causing some complications. So some of the complications of sexually transmitted infections, it can cause what is called subfertility. Subfertility means it reduces your chance of having children. It can go and block the tubes if it's in women. If it's in men, it can go and block the epididymis, that's the tube that carries sperms from the testicles to the urethra. So when those tubes are blocked, it means your chance of having a child are now reduced just because of a simple sexually transmitted infection. 2, you can get what is called ectopic pregnancies. If you're a woman, if the tube is blocked, maybe it's partially blocked and the sperm can access the egg, then you get fertilization, but implantation happens in the tubes or outside the tubes, not in the uterus. With that, you get what is called an ectopic pregnancy. An ectopic pregnancy can result in severe complications. If not diagnosed early and managed early, you might actually suffer from it and die from an ectopic pregnancy if it ruptures. So these are some of the complications. It can also cause aneurysms. Aneurysms, they are growths in the arteries. Usually the main major arteries, the aorta is the one that is affected. So when you get this bulging of the aorta, it can rupture, and when it ruptures, chances are you might not make it and can actually die from the aneurysms. So these are some of the complications. It can even go to your brain and cause psychosis and mental illnesses. So it's very important for you to get treatment for sexually transmitted infections early to prevent any form of complications. The good thing about sexually transmitted infections is they are treatable. Most of them are curable. Besides the viral ones, usually those are just treatable but not curable. But the bacterial ones, they are treatable and curable. By curable, it means when you treat them, you get cured. They are gone and they are gone for good. When you get an infection, it's a reinfection. The one that would have treated would have disappeared. So please visit your doctor when you suspect that you've got a sexually transmitted infection, and please take your medication until the end of the course. When you do that, you reduce your chance of suffering from STIs. Now, just a tip on how not to suffer from STIs. 1, abstinence. If you're not married, abstain from sexual intercourse. By abstaining from sexual intercourse, you reduce your chances of suffering from STIs to almost 0. 2, condomize. When you're having your partner, whether you're married or single or still dating, we encourage you to use condoms. When you use condoms, condoms are very effective in preventing the transmission of sexually transmitted infections, HIV included. So please do use condoms. Then lastly, have one faithful partner. When you're married, we encourage you to have one faithful partner. If you've got a partner who's also not faithful, who's having multiple sexual partners, they increase the risk of you suffering from sexually transmitted infection. If you're also promiscuous and you've got a lot of sexual partners, you increase your chance of suffering from sexually transmitted infections. So remember to abstain, to condomize, and to have one faithful partner. Thank you for watching today's episode of Dr. Joe, where we discussed sexually transmitted infections. Join us again next week. We are going to be discussing prostate cancer. Remember to subscribe to this channel and to like and to share and to go and like our Facebook page, Dr. Joe, our Instagram page, Dr. Joe 263, our Twitter handle, Dr. Joe 263, and also like droptv.com. Thank you.